Thank you very much, everyone, and good morning. I apologize for being late. I had some technical issues. I'm hoping I'll be able to present. For some reason, I had some issues with my PowerPoint presentation. In any case, I just wanted to give you a usual weekly update of what's going on. Certainly a lot has happened since the last time I had my presentation last week. So I'm going to quickly start with just reviewing our I want to review where we are. I want to make sure I have it this time. Our data, which is encouraging and is here we go. So just going to show that there. So basically, we're looking at trends. As you know, right now we're on the downslope of the Omicron curve, and what we're sort of seeing. And Jenna, please let me know that we're seeing the local stats updates page.
Yes, we are.
Okay, thank you. Again, I just wanted to go over some of our numbers, and as I was saying, the provincial trend is going down, hospitalizations, ICU, and so is ours. And you could see sort of in terms of hospitalizations, which now we've got it plotted out here. This is all the hospitalizations in all hospitals in our area, including outside of our area. Some of them are admitted in Ottawa, but you could see sort of, a peak here and kind of flattening down here, which is good. These are all cases that tested positive for COVID. But then we have another graph right here that shows us the decrease in hospitalized and ICU patients over time, and these are the ones admitted to our 4 local hospitals, mostly in Cornwall, with COVID. In other words, they're admitted for COVID, not for other reasons, and happen to test positive. And if we're looking at our positivity, that too, again, I'm happy to report that we're going on a downward trend. You could see that's a nice trend, and provincially we're seeing the same. If we go to our other numbers, which is institutional outbreaks, and again, I've asked my team to put a bit of a trend graph here, which we have, and you could see right now we've got a total of 14. If you hark back to January, we're almost 50, and you could see a straight line downwards for outbreaks, which is again another encouraging sign. Equally, we can see as well the wastewater numbers, and again, orange is Hawkesbury, and again, there's a bit of a peak here, but certainly on a downward trend. Certainly, we're seeing a downward flattening trend both for Castleman and Cornwall, and so this again mimics what we're seeing provincially. And then we're going to the vaccines, and in terms of vaccine administration, I'll show you some other graphs, but this is the one that I'm happy about, because we're seeing a nice uptick in third doses, particularly in the over 70 years of age group. We're about almost 80% now at the 60 to 69. And as I've shown you before, as we know, this is the group that has the highest rate of breakthrough and complications requiring hospitalization. So I really would like, and even 50 to 59-year-olds, we have particularly those with underlying medical conditions are prone. So I'd really like this number to go up as high as we can. I'm quite happy at the way it is going up, particularly in our 70 and 80 plus, because these are the individuals that are actually dying and having complications. Obviously, vaccine does protect them, and so we want to protect them even more by that. So I'm just going to now continue. I have a PowerPoint presentation. I'm going to stop sharing here. I'm just going to load it up on my screen because I always have issues with it. But so I'll share again. Here we go. And so, oops, sorry, this is the wrong one. It's my PowerPoint presentation that I wanted to show. It's this one. Here we go. Okay. Jen, I just want to make sure you're seeing my PowerPoint now with the 455,000 numbers on it.
Yes, we do. Okay,
thank you. So again, this is just shows you, where we are. This is 88.1% of 5+ population that's got a 1 dose. This is 83.4% of 5+ that have had 2 doses, and we're approaching the 60% mark for third doses, which I'm very happy about. And then you could see kind of, in terms of the age ranges there. Again, one of the things that we're seeing, and this is the latest that we got from the Ontario Science Table, again, that just shows you the rates among unvaccinated versus vaccinated, which is the light blue, are significantly higher across the board, be it cases, be it hospitalizations, be it ICU. And in the last week, I showed you even in terms of deaths. So I showed this last week, and I'm going to reiterate it. I put it there on purpose because I just wanted to really show that the Omicron variant does respond more to third dose than it does to second dose, and I'm talking about cases. We do have, if you have 2 doses, you're actually pretty well protected against hospitalization, against ICU admission, and against death. But you're not as well protected as a third dose gives you for Omicron. So the Omicron variant was what we call, immune evasive, in other words, resistant to the 2 doses. But the third one seems to be more effective against the infection itself, 60 to 68%, which is really much better than it was before. But the important thing that it increases even more the effectiveness against hospitalization and severe disease and death. And so that's quite important, and it was worth me talking about that. And I think what the big news is this week is that based on those numbers, and I've told you this in the past, and back in December, I remember saying that we would have a quick uplift of the curve and then downward, and that on the other side of that we would see sort of more progression to opening up, more removing restrictions, eventually looking at vaccine passports and so on. And so that's always been our plan, but this was derailed, for lack of a better word, by the Omicron. And so now that we're sort of on the other side of that curve, we can sort of breathe easier. And so, we're still not out of the woods yet, but we are progressively looking at, some return to normalcy. And as you know, the original date of resuming some more openings was, from January 31st to then February 21st, then March 14th. The government, in response to these numbers that we're seeing, and I must say that for the most part, almost all health units in Ontario are on a downward trend. There's only a couple in the north. And as you'll see later on, we do have the capacity to do some local restrictions. But overall, in terms of the province, the numbers, including all the parameters that I showed you, are following the same downward trend across the province. So effective actually tomorrow, February 17th, 4 days earlier, the social limiting gatherings will go to 50 people indoors and 100 outdoors. Organized public events can be 50 indoors with no limit outdoors, and capacity limits will be removed where you have proof of vaccination, restaurants, bars, cinemas, event spaces, and so on. There will be now 50% capacity at all sports arenas or big concert venues, for example, CTC, hockey games, and so on. So it could be 50% capacity. And now bars and where their dancing is permitted, they could go at 25% capacity with proof of vaccination. And they're increasing the limits for indoor weddings, funerals, rites, and so on, as long as they maintain physical distance. And the capacity limits are removed if the vaccination passport is still in there. So that's happening as of tomorrow. And 2 weeks later, which is again kind of the reason we always go two to 3 weeks between changing steps, because 2 weeks gives us an opportunity. And I must say that between January 31st and now, we actually saw, despite opening up more, increasing capacities, opening the restaurants and indoor gyms and so on, we actually did not see an increase in the cases. We actually saw a decrease in the cases. So now if that trend continues, and I must reiterate, if that trend continues, which I see no reason why not, but if based on that trend, so basically what we'll be doing is that as of March 1st, there will be no capacity limits to indoor settings. They're also going to be lifting the vaccination requirements at all settings at this time, and businesses and others may choose to continue. Now, that is not the mandate. I'm not talking about vaccine mandates. There are vaccine mandates for long-term care staff. And those will continue. We are actually recommending that the third dose be mandated in those settings. And so I do believe that, again, there's a difference between the mandates and the passport. Okay, there's two different things. The passport, which I'm talking about, will be the one that, you have your QR code in order to go to a restaurant or to go to a gym or whatever. You need to show that, and you still need to show that now, but as of March 1st, you won't need that anymore. However, that's not the mandate. The mandates are some of the hospitals have chosen, as you know, most of our hospitals have chosen to continue the mandates, and we do agree. And I indeed, in those situations, what I would support would be to mandate the third dose, because the third dose protects you even more, and therefore you can protect if you're working with high risk settings. So I just wanted to make that clear, that this is not a mandate removal. This is the vaccination passport requirement for entering non-essential services like restaurants and bars and so on as of March 1st. Now you still need it, but moving forward, that's going to be removed. And again, I will talk about that, because despite the removal of the vaccine passport, I still want to encourage third dose, and I think I've explained that last week. And then again, this is the other thing. So to manage COVID over long term, and again, as I've said before, we're going to be living alongside COVID, more of a transition into what I call the endemic phase, where again, we're going to be having to respond at the local level, regional level. You have an increase here, increase there. But as long as we have the tools, and I'll talk about it later, to prevent vulnerable people from getting sick, deaths, prevent those, and preserve our hospital capacity, and at the same time that will allow us to move forward, live within a normalcy. Again, one of the things that I just want to say, that masking requirements, however, this is kind of one of the few last things that are going to be there. Masking requirements will remain in place, and they will be reevaluated regularly as we progress and see what happens, over the next couple of weeks, subsequent to March 1st. To continue. And yes, at one point the plan will be to remove mask mandates, but not right now. And I think that's a sensible approach. It's a stepwise approach, as you can see. So when we talk about moving forward, again, this is a sort of familiar graph that I keep putting out there. We want to move forward, and we need more third doses. The higher percent of third doses in our population, particularly among the elderly, the better it's going to be in our attempt to keep that curve flat and maintain things open. Really, that's the bottom line. So the more people that get the third dose, the higher the chances are that we can, go into normalcy and remain into normalcy. Again, the exception will be the masks and so on. And again, there's going to be a few public health measures there, but I'll talk a bit about them later. So one of the things that's going to increase the third dose uptake in our area and across the province is that effective tomorrow, the third dose will be now offered to 12 to 17-year-olds. Right now, it's only offered to 12 to 17-year-olds that have certain underlying medical or neurological conditions. But at this point, we're going to be adding that. So for us, it represents probably another 10, 15,000 kids in our area. So we'll be closer to that third dose. And again, the reason I'm talking about that third dose is because the modeling has shown that if you reach a certain level in the province, around between 9.5, 10 million, to us, it represents about 140, 150,000 people. If we reach that, right now, you saw we're over 102,000 or so. If we reach that, we'll be able to, again, in combination with all the other things, control and keep things open. And that's the bottom line. So this is what I call the pandemic to endemic shift. Of course, we're going to continue monitoring our high-risk settings, congregate settings, and so on. I wouldn't be at all surprised if we need a fourth dose for seniors or a fourth dose for everyone, in several months. Again, that's going to be part of our ongoing mitigation strategy to keep the numbers down as much as possible. The antiviral medications, which now are available in our area, I think are also going to make a difference. So if you combine a high rate of underlying of third dose vaccination, high rate of a lot of people have got infected with Omicron. So there is a sense, there is a bit of protection. If you combine all those together with the antivirals, we're going to continue. And then masking and usual public health. Oh, I made a mistake there. Basically, the usual public health measures are going to be basically as of March 1st, if all goes well, the masking and the public health measures, washing your hands, physical distancing as appropriate, taking risk, doing a risk assessment. Obviously, if you're an elderly individual and have underlying medical conditions, you might think twice about going to public places and so on. But these are going to still be there because they're going to be the only tools that we're going to have left, but we'll have them on a foundation of good community immunity and the ability to now prevent by medication admissions to the hospital. So I think that we're in a good stead. we're in a good position. And again, we're going to be monitoring these data. People ask me all the time, when are masks going to be removed? Hard for me to say, but I can tell you that I'd like to see a much lower positivity rate. Right now, we're still high. I'd like to see it less than 5%. I'd like to see a complete flattening of our wastewaters, complete flattening of our outbreaks, complete flattening of our hospitalizations, all these things. So how long that will take, I don't know, but certainly there's going to be blips up and down. But if the overall trends are lower, the masking will be removed at some point, but not yet. So Jenna, that's it for me. I'm going to open it up to some questions.
Thank you, Dr. Paul. Merci. Denis Babeil, Radio-Canada, c'est à vous.
Bonjour, Dr. Paul.
Bonjour, Denis.
Une question. Êtes-vous d'accord avec l'échéancier du déconfinement proposé par la province?
Oui. Oui, je suis d'accord. Je pense qu'on a fait ça étape par étape. Je vois que les chiffres ont diminué de façon importante au niveau des indicateurs. Donc, je suis satisfaite avec la façon. Je comprends qu'ils ont coupé 4 jours pour cette deuxième étape et on fait ça dans 2 semaines pour 1er mars. Mais je pense que c'est un trajet que nous avons déjà prévu en mois de décembre. Qu'est-ce qu'on va faire une fois que l'Omicron va diminuer? Parce qu'on savait que ça sera vite une hausse importante d'Omicron, une diminution d'Omicron. Donc, avec tout qu'on a actuellement donné, je pense qu'on a tout la protection fondamentale, si vous voulez, en maintenant les masques. Pour rouvrir l'économie d'Ontario. N'oubliez pas que tout le monde est fatigué, donc je pense qu'on a besoin des bonnes nouvelles de temps en temps, donner un peu une bonne future, si vous voulez.
Parce qu'il y avait un collègue à vous dans le Niagara, entre autres, qui avait exprimé certaines réserves.
Oui. Oui, je peux vous dire que la plupart de mes confrères, je ne peux pas parler pour tout le monde, mais je pense qu'on est tout d'accord qu'on devrait les enlever de façon progressive. On le fait. On n'a pas fait comme Alberta, ils ont tout enlevé en même temps. Je pense qu'on a fait ça de façon progressive, mais je peux vous dire que beaucoup de mes collègues sont d'accord avec cette approche. Toujours, on a la capacité locale, Denis, de réagir. Mais pour le moment, je pense que la façon qu'on le fait, je pense qu'on est bien avec ça. Toujours, ça dépend des chiffres. Si à un moment donné, on commence à avoir des augmentations des cas d'ici quelques semaines, ceci va changer, ça, il va y avoir un délai. Mais si les chiffres commencent à diminuer, je suis satisfait, je suis confortable.
Encore merci, Dr. Paul.
Pas de problème, Denis.
There are currently no more questions in the chat box. If anyone else has questions, please unmute yourself now. If you are joining by phone, press *6. S'il y a d'autres questions, vous êtes invité à ouvrir votre microphone. Si vous êtes joint par téléphone, appuyez les touches étoile 6. Those are all the questions for today, Dr. Paul.
Thank you very much. Merci.